Hey everybody, how you doing? I hope your studies are going smoothly. Welcome back. It's time to start doing some psychopathology revision, and we're going to today look at the behaviorist explanation for phobias. Okay, so here are some exam style questions. I'd encourage you, if you've got the time and space, to pick some and have a go, pause the video, come back and I'll talk through. Last chance. Okay, let's do it. Right, the command word here is identify, so you're just going to tell me, you're going to state. Pay attention to the fact that it's behavioural characteristics, yeah? So probably you're going to go for something like avoidance. You could say something like freezing or fainting though, okay? But avoidance is probably the key one. So avoidance of the phobic stimulus. Right, the second one, outline. So we're going to show knowledge of the behaviorist explanation. So this is a very kind of short overview of the approach. Yeah, so it's only 2 marks, but it's the whole thing. So very briefly, the behaviorist explanation for phobias says that they're learned, for example, through the initiation through classical conditioning and the maintenance through operant conditioning. That'll be fine. Outline the role of operant conditioning. As I just mentioned, operant conditioning is responsible for the maintenance of phobias. We need to add a little bit more information here. So for that second mark, elaborate with something along the lines of, for example, avoidance behaviour, so avoiding the phobic stimulus, negatively reinforces the phobia because it decreases anxiety. Okay? We've got a bit of a scenario question here, some application. We've got Emmy, who's got a phobia of goats. She was once locked in a shed with one, and now she refuses to go into farmyards. Okay. So there's a few things to unpick here. It could actually have been that she could have developed a phobia of just sheds, but here we've got goats that were inside the shed. So what's happened here is some kind of association has been made between that feeling of kind of being trapped or being stuck and the fact that there was a goat there. So that would be classical conditioning. So that's the initiation of the phobia. It could just be that. It could just be that the goat happened to be there and it was just associated with that feeling of being trapped. But it could be, and you could infer this, I suppose, it doesn't really tell us in the scenario, but you could infer that perhaps what happened is maybe the goat bit her, or it was wound up and it ran into her and hurt her, or whatever it might be. But it could, as I said, just be that it was just there. But we've got classical conditioning for that association. So the goat would have been a neutral stimulus, and the feeling of being trapped, or maybe if you said the goat attacked her, either of those would be the unconditioned stimulus, because that is scary without having to learn that it's scary. The unconditioned response would be fear. So we're naturally afraid of, being bitten, being attacked, being trapped, whatever it might be. And that pairing, that association between the neutral stimulus and the unconditioned stimulus, means that the neutral stimulus, so goats, becomes a conditioned stimulus. We've now learned something about the goat. Okay, so the goat is now a conditioned stimulus, and it can elicit a conditioned response of fear. We're now afraid of the goat because it's been paired with something scary. So that's half the question, because it's the 2-process model. So we need to talk about operant as well. So where she refuses to go into farmyards, what Emmy is doing there is avoiding any possible contact with goats. And therefore, when she sees or has a thought about going to a farmyard, she's going to become very anxious, and that refusing to go into is avoiding, it's reducing that anxiety, so that's negative reinforcement. Okay, so she's taken away something bad, that anxiety, which encourages her to continue to avoid and to fear goats. What you could do here, and possibly, to really try and get into that top band and impress the examiner, is you could say she's not just avoiding goats, she's actually avoiding farmyards as a whole. So you could introduce another bit of knowledge here, because that is stimulus generalization. She's learned something about goats, and she's generalized that fear to other kind of similar or nearby stimuli. So goats and farmyards are very much associated, of course. And the fact that she's scared of goats, she's generalised that to also being afraid of farmyards. You could argue that. Okay, we've now got a bit of comparison. We're going to need some comparative language. We've got distinguish between the role of operant and classical conditioning and phobias. So the key difference is that one is involved in the initiation, so that is classical, and one is involved in the maintenance, and that is operant. So you're going to get a couple of marks for just making that distinction, but elaborate a little bit more to get up to that 4 marks. Yeah. So classical conditioning explains the initiation of phobias, for example, where an initially neutral stimulus, the phobic stimulus, would be paired with an unconditioned stimulus that is naturally scary, whereas operant conditioning explains the maintenance of phobias. So avoidance is negative reinforcement, which explains why a phobia would continue and not disappear. Yeah, because without that maintenance, what should happen, I suppose, according to classical conditioning, is we should see what's called extinction. We should see that that phobia disappears. Okay, one limitation of the 2-process model here. So for 3 marks, explain one limitation. We're looking for a peel or kind of a point, explain, conclude kind of paragraph here. Okay. So one of the most common limitations of this theory is that it's an oversimplification. Yeah. So one limitation of the 2-process model is that it's an oversimplification. There's your point. We need to explain that point. Well, why is it an oversimplification? Well, it only focuses on the role of environmental factors, or only focuses on the role of learning, which means it ignores biological factors. Yeah, we know that, or we think that some phobias have an evolutionary or an evolved element. You might have heard those called ancient fears. Yeah, things that it would have made sense to be afraid of back in the day. Yeah, the caveman era, or the environment of evolutionary adaptiveness or adaptation. So because it ignores those factors, the 2-process model is a limited or a partial explanation for phobias. Okay, point, explain, conclude. Discuss one strength of the 2-process model. Okay, so it's 4 marks, so we're going to have to write a little bit more, but also the command word has changed here. It's discuss a strength. So what you're going to do is you're going to tell me a strength, or tell the examiner a strength, and then you're going to maybe elaborate on it and possibly kind of undermine it a little bit. Yeah, so present 2 sides if you can. So a strength of the 2-process model is its real-world application. Understanding that phobias are learned has led to different treatment options for people experiencing phobia. So you should be aware of things like flooding and systematic desensitization. So this is a really strong aspect of this theory because it's actually useful for helping people to deal with their condition or their mental health. Yeah, and it is effective. Yeah, research suggests that these treatments are kind of 70 to 80% effective. Yeah, so that's the strength of this theory. What you wouldn't do necessarily here is delve too much into how the therapy works, or discussing the therapy in too much detail, because what you're trying to evaluate is the theory. But the fact that there's a therapy based on the theory is a strength of the theory. Okay, in order to discuss this, the counterpoint might be that actually the therapy doesn't work for all patients or for all clients. As I said, you don't want to go off too much into evaluating why that is, because we're evaluating the theory. So the way to use that would be something like, however, one limitation of this application is that it doesn't work for everybody, and this means perhaps that the 2-process model or the behaviorist explanation only has limited applications. Yeah, so I've linked it back there to the theory because that's what I'm trying to evaluate here. Okay, we now have an 8 marker. It's just a straightforward describe and evaluate. So this is probably going to be 4 marks plus 4 marks. I suppose it could be 3 plus 5. It's probably 4 plus 4. So you're going to give an outline. We've been through all of this. So a couple of marks for describing how classical conditioning is involved in the initiation of phobias. And a couple of marks for describing how operant conditioning is involved in the maintenance of phobias. So for bigger questions, remember they're levelled. You want the specialist terminology, you want the detail and the accuracy. You're going to use terms like your UCS, your NS, your UCR, your CS, your CR. And then in terms of the operant side, you're going to use terms like negative reinforcement. Okay. For an 8 marker, I'd be looking probably for 2 evaluation paragraphs. So you could do 2 just point, explain, conclude. So you could do a limitation. We've talked about that earlier, the oversimplification idea. And you could do a strength. So the idea that real-world application to therapy is useful and effective. Again, for a leveled question, to make your evaluation thorough and effective, if you've got time, do try and introduce a counterpoint. So maybe just lift that paragraph we just did for the discuss one strength question and put that into this response. Okay, so to level that up to a 16 marker, we just want a bit more in terms of quality and quantity. So in terms of the knowledge, make sure that you're talking through that whole classical conditioning process. You could mention the idea of stimulus generalization. That would be something that I don't expect all candidates would include, so that would impress the examiner. We mentioned that one earlier. In terms of evaluation, I'd be looking this time probably for 3 discussion paragraphs. We've already talked about 2. Another one could be the fact that it's supported by research. So you could bring in the Little Albert study that you're probably aware of by Watson and Rayner, where they conditioned the child to fear white rats by striking a metal bar every time he went to touch it. The interesting thing about that one is that it also showed stimulus generalization. So if you've mentioned that in the knowledge, you could bring that back in to say that concept is supported as well, because little Albert went on to fear other animals and also other white furry objects. So there was like a Santa beard or something, or some kind of mask that they used that he grew up to fear. So there's research support. You could also counter-argue that with some research that doesn't support it. So there are studies that have tried to condition other sorts of phobias. So there's a study by, I think the name is Bregman or Bergman, something like that. I think it's Bregman. And they basically tried to teach children to fear wooden blocks. Yeah, literally like building blocks that you play with as a kid. And it didn't work. Yeah, they couldn't condition that fear. So what does this show us? Well, it shows us that the 2-process model maybe isn't a full explanation for phobia. Maybe it only applies to things that potentially could do us harm. Maybe it only applies initially to animals or whatever it might be. But there certainly is more to it than just you can condition a phobia of anything, according to some research. Yeah. You could also introduce, if you wanted a different point, there's research that shows that not everybody with a phobia has some kind of traumatic event that triggered it. Yeah. According to this theory, there should be some kind of initiation event, yeah? Some kind of classical conditioning that's happened that's made them fear whatever the stimulus is. It might be, a phobia of a dog, and it might be that they were bitten by a dog, or it might be that there was some kind of wasp that stung them or something like that, and that's initiated the phobia. Well, actually, if we ask people about their phobias, not all of them tell us there was some kind of event. Well, this undermines the 2-process model, as I said, because classical conditioning says there should be some kind of event that started it. Yeah, so this undermines the validity or the credibility of the 2-process model as an explanation for phobias. You could discuss and counter-argue that, because psychodynamic psychologists might argue that actually those events probably did happen, but people have repressed them, they've forgotten them, they've pushed them down into the unconscious because they were painful memories, they're traumatic memories. So maybe actually that doesn't undermine the 2-process model. Yeah, or it undermines this challenge to the 2-process model. Okay. Right, so you've had a go, we talked through. What happened? Why did that happen? And what are you going to do next? How is this going to feed back in to your ongoing learning and revision? What do you need to do next? Cheers, everybody. I hope that was useful. See you again soon. Bish, bash, bosh.